CapeTalk. Pippa's on Twitter.
You can tweet her at PJC Hudson.
Right, I don't consider myself a complete idiot, but if there is one space that makes me really question my intellectual abilities, it's trying to navigate and understand the ins and outs of my medical aid. And I know that's a really middle-class complaint because only about 16% of us are lucky enough to even have a medical aid in South Africa. But still, it can get really complicated and really hard to compare apples with apples when you're trying to make a decision about sticking with the one you've got or switching to another one. So I thought we'd call on an expert today to try and help us navigate some of the crucial concepts that inform those choices and answer any questions you might have about what they actually mean. 021 446 0567 is the number to dial if you'd like to ask a question, or you can pop through a WhatsApp to 072 567 1567. Our guest is Gary Feldman, who is the Executive Head of Healthcare Consulting for NMG Benefits, which is a financial intermediary firm. Gary, it's great to have you with us. Welcome.
Good afternoon, Pippa, and good afternoon to the listeners.
Thanks for joining us. Maybe a little premature to have this conversation now, Gary, because I know most people make decisions about reviewing medical aids in the final quarter of the year. But if anything, I just hope this chat will start the thinking process about what we should be asking when we talk to a broker about making a change. First of all, the fact that a medical aid is not the same thing as a health insurance. And health insurance is perhaps more of a new concept to South Africans, but people do get them confused quite a lot. Gary, shall we start there? What's the difference between the two?
Pippa, I think it's a very important question. I think people are realizing that medical aid contributions are becoming unaffordable and are looking for alternatives. And the medical insurance type products have become more popular. But we warn people that a medical insurance plan is definitely not a medical aid for a number of reasons. Firstly, they don't have to comply to certain of the regulations, so they don't have the comprehensive cover. Secondly, that it doesn't count for membership of a medical scheme. So should you later in life want to convert to a medical scheme, you might be underwritten and or you might have late joiner penalties because that is anti-selection joining a medical scheme later in life. And the Medical Schemes Act makes provision for that specifically. So those are some clear guidelines. And I say to people that it's better to have a health insurance plan than nothing at all. At least you have some form of primary healthcare cover in an insurance plan. But most of them give you limited cover, limited GP visits, and also the hospital cover is usually just in terms of accidents or an emergency. So it's not like if you've got a planned procedure, you have to have a planned hip replacement or anything like that. You wouldn't have cover on an insurance type plan.
Okay, that's really important. So thanks. That's news to me what you've just said. So if you have medical insurance, even if you've had it for 40 years, when you go to join a medical aid 50 years later, they're going to say, sorry, you weren't covered for that period, so you will pay a late joiner penalty. And Gary, those late joiner penalties can be quite significant, can't they?
Absolutely. Late joiner penalties come effective from the age of 35. So if you join a medical scheme after you turn 35 years old, they start calculating, and it starts off at a 5% penalty, and that penalty can go up to 75% for an older person. And that penalty is with you for life. So when you join a medical aid at the age of 50 and you've never had any cover, so they'll calculate 15 years you didn't have any cover, so that will give you approximately a 35-40% late joiner penalty. So if your medical contribution would then be 4,000 Rand a month, you've got an additional penalty that will be calculated, and you'll pay that penalty for as long as you're a member of that medical scheme.
Okay, so really important to be aware of that. Gary, I mean, lots of different plans in many different shapes and forms and what they offer and how many visits are covered at what hospitals, etc. It's often very difficult to be able to compare apples with apples. Let's talk about some of the basics, though. For a lot of people, cost is the key factor. The cost of healthcare is going up. The cost of medical aid cover is going up, as is everything else. And a lot of people are simply going, I can't afford comprehensive cover. I'm going to take the cheapest option, which is a hospital plan alone. Are there any other sort of budget-friendly options to consider if you are in a really constrained financial position?
Yes, Pippa. We at NMG help people understand what they've got and what they need. I think it's really, number one, looking at what your requirements are. If you have got a chronic condition, you might want to look and say, right, what are the chronic benefits of the plan? If you're fairly healthy person, then yes, a hospital plan is the basic minimum that we recommend people to consider, because you don't want to land up in a public hospital in South Africa at this moment in time. You want to make sure that you've got access to a private hospital that's going to give you cover with private medication, private doctors, etc. So ultimately, I mean, if you consider you've got 230 odd options on basically the open medical schemes in South Africa.
Yeah.
So it is a very complex environment. And we always say, make use of a broker. A broker is going to assist you to identify the most suitable plan. It's a complex environment and it's an expensive item that you've got to purchase. It's become a grudge purchase for many people, but I always use the analogy. You drive a car out of a garage once you purchase it. The first thing you do, you insure the car. But people are reluctant to insure themselves. And I'm saying take the basic insurance, and then even if you have to self-fund your day-to-day benefits, make sure you at least have comprehensive hospital cover.
Okay, thanks for that. Gary, Trish asking a very important question about gap cover. It's a concept a lot of people are even more confused by. What is gap cover and who should consider taking it out?
But another very important question that people are not informed about. Gap cover is an additional product to medical aid. So you cannot have a gap cover product unless you have a registered medical aid. So you can't have coming back to the insurance type product, you can't have an insurance plan plus gap cover. It's got to be a registered South African medical aid. And then you take gap cover. Now, what does gap cover do? In South Africa, in a private hospital environment, a lot of the providers, being specialists, anaesthetists, surgeons, charge more than what the medical scheme will reimburse at.
Yeah.
And you've got a shortfall. So the gap cover will then pay the shortfall between what the medical scheme reimbursed and what the provider charges. So gap cover has become a critical part of comprehensive medical cover in South Africa at the moment. We speak to all our clients and saying, make sure that you've got gap cover, especially if you've got a medical scheme plan that's reimbursement rate is at 100% of the scheme rate. You get more comprehensive plans that reimburse at 200% or 300% of the medical scheme rate, which makes gap cover less important. But if you've got a 100% reimbursement plan, gap cover is critical in today's environment.
And is that something that a broker like yourselves would be able to assist with in addition to helping you choose a medical aid itself? Gary, would you also go to your broker to talk about gap cover, or would you consult somebody else?
No, absolutely. Most healthcare brokers will also consult on gap cover. I think it's from a regulatory perspective, it's almost best advice to give a member the option of taking gap cover as well, because ultimately you're not giving your client good advice if you're not recommending gap cover as well.
Okay. Gary, another thing a lot of people don't fully understand or don't know to look for and sort of follow up that it's being handled correctly by their medical aid is coverage that falls within prescribed minimum benefits. Can you perhaps spend a little bit of time explaining to us what that is and what you need to do to ensure that you receive the cover you meant to?
Well, yeah, I think that's, once again, a very important point that you raised there. Basically what happens is, as I mentioned earlier on, the difference between an insurance plan and a medical scheme. Insurance plans don't have to cover prescribed minimum benefits. So every medical plan, no matter if it's a basic hospital plan or a comprehensive plan, is obliged by law to cover prescribed minimum benefits. And quite often, medical schemes do not pay out because the doctor might have put the wrong ICD-10 code. That is the procedure code that the doctor will capture on his or her account. Mm-hmm. So what happens is, for argument's sake, let's use an example. If you're involved in a car accident, that is seen as a PMB, a prescribed minimum benefit. So your hospitalization, your medical costs should be covered in full. And if the doctor didn't use the right code for the procedure that he or she did on you, then the medical scheme will basically repudiate or not pay the claim. And that's where the broker can assist you to make sure that you basically, between your provider and the medical scheme, the procedure is covered correctly and paid in full. And there are a number of PMBs that people are not sure of. And that's where a broker, once again, can assist you, because brokers know what the PMBs are and that PMBs must be paid in full.
Yeah.
And they're there to assist. And the important point, Pippa, I must make is that if you don't use a broker, you're compromising yourself, because you're not going to get a cheaper rate from the medical scheme. The medical scheme rate that you pay includes regulated broker commission. So at this stage in South Africa, if you had to go to any one of the open medical schemes and you go directly to the medical scheme, you'll pay the same rate as somebody who comes to the medical scheme via a broker like ourselves.
Okay, that's such an important thing, because my next question was going to be, do you pay a broker to do this for you? Gary, if I'm understanding you correctly, you as the client don't pay well, you do, but it's factored into the scheme that the rate is going to charge you anyway. Is that correct?
Absolutely. So the broker fee is regulated in South Africa in the healthcare environment, And it's, as I said, it's included in your rate. So you're not going to get a discounted rate going directly to any medical scheme at the moment. That rate that you see quoted includes a broker fee. So if you don't use a broker, you're actually compromising yourself, because a broker is there to assist you and to look after your needs and to look after your well-being as far as your healthcare cover is concerned.
Gary, I've got a very skeptical Selwyn saying medical aid brokers are just selling a product to you. They don't give you enough information about what the package entails. Do you maybe want to respond to that? And I mean, I know some people have the concept that a broker is in bed with a particular medical scheme and is only going to advise you on those plans, for example. Would you like to respond?
But yeah, I'd love to respond. I think it's basically a generalization, and it's quite unfair in most instances, because if a broker is worth his or her salt, they will definitely make sure that they inform you of any changes. They make sure that you've got access to them on a 24/7 basis, that you can access their staff and they're there to support you. If a broker is not doing that, then he's not fulfilling his obligation to his clients. And ultimately, I think coming back to us at NMG, we make sure that we engage with our clients on a regular basis. We keep them informed of any changes in legislation, any changes in their benefit structure, and also ultimately their changes in their contribution on an annual basis. Because as we know, your contributions in medical scheme environment are higher than CPR. I mean, we see traditionally your medical scheme contribution is CPR plus about 3%. So it is becoming more expensive for people, and we've got to make sure that they are in the best, most suitable plan within the medical scheme of choice.
Gary, would you be able to advise a corporate who's got a whole lot of people on a plan? Now, somebody's asking if I've got a company and would like somebody to assess the medical aid we're already on and advise us on whether we should be changing. Is a broker the right person to go to as well for that?
Yeah, Pippa, we at NMG do that on an ongoing basis. We help brokers. We look at what their staff are on. Is it the most suitable, number one, the most suitable scheme, medical scheme? And then secondly, once you've identified the most suitable medical scheme, you look at the staff members' individual needs and then identify the most suitable option within that medical scheme. Because most medical schemes have got a minimum of 5 to 20 different options in their scheme. And ultimately, you've got to make sure that you're on the most suitable one. Number one, as I mentioned earlier on, from an affordability perspective, and number two, from a benefits perspective, that it meets your expectations.
Gary Feldman, thank you so much for your assistance this afternoon. Gary is the Executive Head of Healthcare Consulting at NMG Benefits. They are a financial intermediary firm whose basket of services includes medical scheme consulting. So if you are in need of that kind of support, you're welcome to look them up. Gary, we appreciate your help with our listeners' questions this afternoon.